Afternoon, everybody. I'd like to call the Health and Human Services Board to order at 5 p.m. Roll call, please.
Julie Medeiros. Dr. Anwar.
Present.
Supervisor Lind.
Present.
Supervisor Anderson.
Present.
Supervisor Leaf.
Present.
Supervisor Osnes. Present. Supervisor Telejohn.
Present.
Supervisor Barkalow.
Present.
Deb Lindeman.
Present.
We do have a quorum. Everybody's here. Great. If there's no objections to the minutes from September 21st, they'll stand as approved. Are there any objections or any corrections? Hearing none, the minutes are approved. We have a time for public comment right now. Is there anybody here to speak from the public? Anybody here to speak from the public? Nobody's rushing to the podium. Next is business items. 2023 proposed rates for St. Croix County Healthcare Center Skilled Nursing Facility. Bob?
Thank you, Mr. Chair. We have one proposed rate adjustment for the healthcare campus. It relates to the skilled nursing facility. It would be an increase of $15 per day, increasing from $295 to $310. That's after Sandy Hackenmuller, our administrator for the healthcare campus, looked at comparable rates at other facilities in the area. At $310 a day, we'd still be at the low end of the average for other like facilities in the area. So we're proposing an adjustment to that rate to be more in line with other facilities in our region.
We need a motion on that, right?
Yes.
I move to approve the 2023 proposed rates for the St. Croix County Healthcare Center Skilled Nursing Facility.
Is there a second? Second. Dave? Any discussion? Any questions? Hearing none, we'll take a roll call vote.
Oh, because it's money.
Go ahead.
Never mind.
Julie Medeiros.
Yes.
Dr. Anwar.
Yes.
Lisa Lind.
Yes.
Sean Anderson.
Yes.
Everybody has a mic for him.
Kathy Leaf.
Yes.
Dave Osnes.
Yes.
Greg Telejohn.
Yes.
Mike Barkalow.
Yes.
Deb Lindeman.
Yes.
Motion passes.
Boy, after all that.
Health and Human Services monthly financials.
I had to hold mine down.
Okay. So we'll go over the financials from the packet. One of the things I wanted to talk about briefly, if we compare September of 2022 to September of 2021, you'll see revenues are down, $300,000. When you look by line, we've had a lot of movement across multiple revenue codes. So our health grant, which is primarily public health, that one's down just because last year we had all of the LTE staff, we have all the Arpa funding that was being done for the contact tracing and all of that. So again, we've just had that much less services within that department with that grant being down. The next grant, that's just a timing of payment. So some of our state payments, they release money the first 4 months, and then they wait until month 6 or 7, and then they release another big chunk of money. So here in October, we had $900,000 that came in for our family and children's. So that's kind of very apparent in that line of the timing of that payment. You look down at Human Services, the 46610, and that's our Comprehensive Community Services Program. That one's up significantly, and we've talked about that we just had that many more referrals within that program, so more services being provided. And then even on this same line, when we get down to YCSS revenues, birth to 3 revenues, and revenues, family and children, just again, that increase in services. Specifically in YCSS, that's our Children's Long-Term Support Program. We actually did move a position from CCS, Comprehensive Community Services, to Children's Long-Term Support, just because of the number of increases in caseloads. That's a program, because of the way the state funds it, is almost fully funded. So we'll see those revenues continue to grow throughout this year. We'll be over budget in that one pretty significantly. And actually, the payroll won't be impacted because it was a position that we moved from one area to another. A lot of the red that you're seeing, what we're doing is we budget to the best of our ability where we've spent expenses in previous years. If we have another line item that's more appropriate this year when we spent the money, we're going to code those expenses to that line item, even if we didn't budget there. What we monitor is just within those departments that our operating expenses are staying where we expect them to. So we're not worried about it line by line, just overall within behavioral health or children's services, that we're staying within that operating budget that we had set. From there, I'm going to flip down to our healthcare campus, and they are on page, we'll probably look at page 28. Just to reiterate that our healthcare campus is doing well. Their revenues over their expenses are coming in. More revenue than operating expenses. On the nursing home side, when we get to page 31, so last month the nursing home was showing a profit. This month they're a little behind. That will catch up with itself later. We had 3 payrolls here in September, so the payroll was very apparent then on the nursing home side because of that close relationship between the staff and the revenues coming in. And then we also have some of our pooled staff bills are coming in. So some of the state stuff that we had from back in July when we had staff coming in, we're just paying those bills now. We will get supplemental money at the end of the year, so we still expect the nursing home to finish positive. Any questions for me or any other areas that I can provide information on?
Anybody? Mike?
So to kind of summarize, it looks like the whole department is under budget, but there's a few line items that are over and would get reassessed for this next biennial or next annual budget, correct?
Right, so I mean, line by line, if we have an expense, maybe we spent more in software than we spent in operating supplies, right, and we just kind of go where we were the previous year or historically, but if we have a new expense that's appropriate for something we need that's within the overall operating budget, we just code it there.
Okay, thanks.
Any other questions? No? Okay, thank you.
You're welcome.
Next item on the is Health and Human Services Board Orientation Presentation.
Thank you, Mr. Chair. I'll just introduce Rhonda Brown, who's our Economic Support Division Administrator, and Rhonda's going to provide a brief orientation on what her division does tonight.
Thank you, Colleen. Hello. As he said, I'm the Division Administrator for Economic Support, and I've been in my position since May of 2010, just to give you an idea of that. The first slide here really is just a snapshot of our current staff, which has been pretty consistent for years. So I, myself as the administrator, We have 2 lead workers, and we have 11 specialists. Our last position was filled in September 2020, so while other counties, even within our consortium, have had pretty continuous turnover through the pandemic, we've been fortunate. We really have a fantastic local team, so very service-oriented, and it's an extremely task-oriented kind of position, very high performance-oriented, and they're definitely fit that part. It's not mentioned on here, but I do also want to mention that we have amazing support as well from the reception pool, who assists with our walk-ins and processes mail and scans our document. All of our files are electronic. So I just want to mention that as well. We appreciate their support. In addition to some of the emergency vault cards, for example, reception staff also issue those. So wanted to mention that. To give you a perspective for our 14 FTEs in our division, our consortium, which I'll cover here next, it has about 135 staff roughly, and that includes supervisors, lead workers, and specialists. So just again, to give you some perspective. The next slide is just a visual of the statewide consortium model. We began as a consortium in January of 2012. You can see that this is how it's structured. The whole goal of it was to gain efficiency and cost savings, basically, in service delivery by having us work together in it's called a consortium because the counties weren't required to be contiguous, although they are. So for us anyway. So instead of a regional model, but I guess that would be probably a more familiar word. So we operate regionally with 10 other counties. The state manages a portion of our document processing. As you can see, the state took over the funeral and cemetery aids program that we used to administer here at the county. They also took over third-party liability and MA transportation. So those were all things that we did at one time here within our division. The consortium then, the one requirement to be a consortium is to have a call center. That's in our contract. We're required to operate a call center. So my staff are essentially agents at least half of their day, their work day. So they spend about minimum of 4.25 hours on the phone every day. And with phone appointments, in addition to that, they spend more likely about 6 hours per day on the phone. Also returning phone calls or whatever it may be. We process applications, changes, and renewals for our program, customer education, problem resolution. We also do fair hearing, so everyone has the right to a fair hearing if they disagree with an eligibility determination, so that's something that our lead workers actually manage. And then program integrity and benefit recovery, so that's a big part of what we do as well. Staff have error-prone profiles and things that they manage kind of in their day-to-day work, but our consortium also has a benefit recovery team. One of our FTEs that I just showed you, Matt, is actually on the benefit recovery team for our consortium. So they work on processing overpayments, and we can gain incentives funding that comes back to us from some of that overpayment processing. So obviously, with managing public assistance, part of that is managing program integrity and making sure that if someone received benefits that shouldn't have, that we look at that as well. And then locally, we're also required to have lobby services. I mentioned that with reception that they assist us with. And then we are also required to have face-to-face intakes and renewals if requested. We last year had one. Over the last decade, our customers really have become accustomed to a call center. So we just don't see that many people that want to be seen in person anymore. And obviously the pandemic had a big part to play in that as well. But it's really been for years just dwindling down that we've had face-to-face, but we are required to offer that if it's requested, and of course would offer that. And then the last part, kind of a combination: fraud, quality assurance, document management, and training. So those are other things that we work in relationship with our state partners, other consortium, and our local partners as well. The next slide explains Great Rivers Consortium. So as I said, our statewide operations began in January 2012. Our counties are Barron, Burnett, Chippewa, Douglas, Dunn, Eau Claire, Pierce, Polk, us, and Washburn. And again, just giving you kind of a visual there of how operationally we are set up. Contractually, DHS, the state, contracts with our lead agency, that is Eau Claire County, and Eau Claire County, in essence, contracts with us to do the work, is how that's structured. I gave you a little bit of information there in terms of our average caseload, which has grown substantially in the last couple of years, and the average number of recipients has grown as well. So that's something that we try to keep an eye on for the reasons that I'll use the pandemic as an example with temporary policies and procedures. I started tracking more recipient numbers because the changes in policy procedures actually impact more at the recipient level than they do at the case level. So maybe a better way to say that would be that the same households are open, but there may be changes for people within the household, meaning someone is no longer eligible or someone is now eligible based on a program policy change. Staying on top of program and policy changes, system changes, that's something that we do all day, every day. And then obviously relaying that and educating our customers is a big part of that as well. So what we do, our division administers public assistance program. Our primary programs are caretaker supplement, food share, Medicaid, and then the Wisconsin Child Care Subsidy Program. I think you'll hear a little bit more about those with the mandated services discussion. We did subcontract energy assistance. I believe we began doing that in 2013. But this year, just this season, it runs on a federal fiscal year. So beginning in October, WestCap has the direct contract with the state on that. So we no longer subcontract. We wanted to have an administrative oversight of that program because it's a pretty significant program to our consumers, and we wanted to have some input on that in terms of outreach, and obviously we know our residents well, and we just wanted to make sure that we had kind of a say in what that looked like, as well as how funding was spent. But as I said, that has now changed. The state has requested to contract directly with WestCap, and that will be the state going forward. In essence, it would have cost us tax levy to maintain the program, so just kind of progressed to that point. Other nuances consumers may experience with program eligibility, premium payments, patient liability, cost shares, and then mandatory work participation, so those tie in to the programs that I mentioned there. Our staff determine program eligibility and benefit amounts by assessing really stringent financial and non-financial guidelines. So that's at reported changes, at applications, and at renewals, which are required annually, potentially more often, depending on circumstances, but I won't go down that rabbit hole. So, you know, it's as I put in here, our role in judgment really is eligible, not eligible. My staff are looking at non-financial and financial guidelines. You meet them or you don't. A lot of times you hear about our programs being entitlement programs, meaning everyone gets them or anyone who applies gets them. That's not the case. That's actually a misperception. What entitlement means is that anyone who applies, we are required to respond to that request for assistance. So if a particular individual applied every day of the year, we are required to respond to that. It does not mean that they're eligible. That's a whole nother thing. The other thing I think is important for our division in relationship to other divisions potentially is just that we are not in an advocate role. So we're not working to determine to make someone eligible or figure out how they might be eligible. We are in the business of responding to information that is provided to us, comparing that to non-financial and financial guidelines, and determining eligibility, yes or no. So for whatever program they may apply for or be renewing. And again, there's some additional information, they may be eligible, but then with a premium payment, so we might have that discussion. So that's why I wanted to mention some of those nuances. In addition, oh, yes.
I'm just wondering, if you do have people that come through that are not eligible, do you make referrals if they do need help, obviously, somehow?
Yeah, I always say that resource and referral is kind of an unfunded mandate for our call center. We do a ton of that all day, every day.
That's what I thought.
We actually have, myself, the SharePoint site is our centralized information resource for our consortium that I manage. And we have what we call contact list on there for all of the consortium. There's hundreds of contacts. So they do answer those questions, for sure. Yeah.
What are some, like you said, there are financial and non-financial considerations. What are some of the non-financial ones? Is that like family size or stuff like that?
It is, yeah. It can be family size, can be adult or child, can be elderly, disabled. It's those types of things. The food share program, depending on other non-financial items, could be whether they are working or not working, that type of thing as well. So there's several of them. Yep. I was going to say also in relationship to your resource and referral question, just that it's not only if they're eligible or not eligible for our programs. Obviously, our division is vested in our department, and so we want to make sure that they are aware of the programs and services that our department provides and that our county provides as a whole to start. And then we go from there. The community agencies are obviously very important too, and we don't offer everything. We see people with very complex needs, generally in vulnerable circumstances. So even if they are eligible for our programs, we may end up referring them to someone, say, for housing assistance, transportation assistance, that type of thing. And some of that information I listed right away. So for non-emergency transportation that the state administers, it could be referring them to the state as well. So thank you for the questions. That one other thing I wanted to cover on here that is another common misperception is that covered providers and covered services are an outcome of our determination, but that is not our area of expertise. So member services is managed by DHS with the state. We get a lot of those questions and we refer them to member services for those types of questions. So we determine whether they are eligible for medical assistance, which may be a pay source. If they have some type of a service or see a provider that may not be covered, that is not something that our division does. We're not going to help them resolve billing issues. So just wanted to note that. The accessibility of programs and services. So our virtual call center is really the heart of our operations that I mentioned. It is virtual, so there's no physical location to it. There never has been. With the exception of long-term care intakes, all programs and services are delivered in the call center. We initially started out as a call change center, change reporting center, with the goal of incorporating into a one-stop shop eventually. So that's where we've been working for years, and we do that very efficiently now. Long-term care intakes are probably the most complex intake that we have, so we have some nuances with that particular program. Our consortium is open Monday, Tuesday, Thursday, Friday, all day, and then a half day on Wednesdays. The reason for that, we approved that with DHS so that our staff would have time to meet, time to read operations memos, program policy and procedure stuff that changes so that they're knowledgeable and accurate and timely. So initially when we started out, we were open every day and then realized that our staff didn't have time to maintain job knowledge, and it's critical. So again, very complex programs. Consumers can check benefits, get reminders, submit documents through My Access Mobile. That's just come out in the last few years. The state is really investing a lot of time and energy into mobile for obvious reasons. We probably all have a phone in our pocket, and that became the more obviously beneficial for customers as well. So that is a pared down version of the next bullet, which is accesswisconsin.gov. So they can do anything online 24/7, obviously. When Access Mobile came out, it's a pared-down version of the online resources, but I think, again, with the goal of improving and increasing that over time. They also can visit our local lobby. We are required to have a phone and computer available. So those are self-service items that we have in our lobby. The computers obviously are locked down to certain websites, including Access that I just managed. And it's the same with the phone. They can press an option for our call center that we manage or to the federal healthcare agents. And then also, I think, Judicare, or we've added a couple other ones, but. And then lastly, they can still contact our division. We do have a main phone number to request mail-in and fax-in options as well. So reception generally responds to those requests. And in some instances, they're more of a catch release, meaning if it's anything too complex, they're going to likely refer it to our call center. That's where our staff are all day. So. The next is just to give you a visual of recipients, adults, children, and then a total. This is for St. Croix County, and then in comparison to income maintenance recipients for Great Rivers. Great Rivers is about Great Rivers Consortium caseload, not recipient number, is about 8% of the statewide caseload. Again, just to give you some perspective. The next is comparing an average recipient numbers. This is based on the April 2020 census estimates. And just to show you, again, a comparison, this is a percentage of residents that are served in each county. You can see that St. Croix County has the lowest percentage of residents receiving services. Now, granted, they could apply and potentially not show up in our statistics. Again, back to what I said about entitlement, we respond to any request we receive. That may never end up in a number that you see. So we are providing more services likely than this. But again, just to give you a comparison to other counties in our consortium, it's pretty significant when you look at that. Burnett County, for example, double what St. Croix County is. The next slide is a similar sort of comparison here, just in terms of our benefits expenditures. So the work that my staff do, our staff in the consortium as well, these are the expenditures that are result from that. So again, based on eligibility, low income, vulnerable individuals, and they also obviously support local businesses as well. You know, food share is spent at grocery and convenience stores, hospital clinics, childcare providers in our area receive childcare subsidy, and then electric and heat vendors as well. The next slide shows you the last two slides, actually, but just a little bit of a performance snapshot. Again, my staff are at a computer all day, every day. Me as well. That's what we do. We're not out in the community. Our job is very technical. It's systems. It's multiple systems. It's stringent policies and procedures. It's at a computer. That's what we do. So everything is very measurable. And that's what you're seeing here for our call center, and then just in relationship to applications and renewals and SMRFs, which are 6-month report forms, just to give you an idea. And our consortium performs excellently. If you factor in a consumer aspect, someone not submitting something timely, for example, I don't think we can get higher than 99.6, for example, timeliness. The requirement for our contract is 95% or above. We're far surpassing our contractual requirements in terms of answer rate, average speed of answer, and timeliness and accuracy. So that's something that we monitor on a monthly basis in terms of we actually report out to our staff. They're well aware of what our performance scores are. And the reason why that is important is it directly relates, obviously, to the customer experience. So the higher our talk time, if our average speed of answer changes, the customer experience may not be what it needs to be. Then we start seeing complaints. Individuals may be waiting longer. And these really are life-sustaining services. It's food, it's medical care, it's prescriptions, it's that type of thing. So I don't want to say that from it's obviously very important from a human aspect, even though I'm showing you numbers on a page, right? Any questions on anything that I Yeah, of course.
When you get calls to the call center, can they be from anywhere in the consortium, or is it specific to St. Croix?
Anywhere in the consortium. Yep.
Any other questions?
I was just going to also say our consortium is, I'm part of several state committees, so I have the luxury, if you will, of seeing how other consortia in the state operate. And I'm proud to be part of our consortium, and that is not anything negative against any other. It's just to say that we spend a great deal of time communicating and collaborating way beyond what others are. We really operate as a consortium. We meet twice a month as managers. Our lead teams meet twice a month. We have all staff meetings. We have all trainings. I mean, so we really leaned into the goal of efficiency, cost effectiveness, and providing services that met the needs of our consumers as quickly as possible, and have become pretty skilled at that. So I just wanted to mention that because that is unique for us in comparison to others who in some respects are still operating, maybe not communicating or collaborating as much as we do. So, and Bob can maybe attest a little bit to that because he also has to attend directors meetings, right? So we refer to as our leadership committee, but.
Very good information. I didn't realize exactly how much you did and as a consortium. Yeah, very good.
Yeah, thank you. Appreciate that.
Dave?
Thanks for the questions as well.
And Rhonda, as you well, you and I had a quick conversation before the board meeting got started. And it's amazing the number of phone calls that I get. And every one of them has been positive on the good work that this particular group does. And my hats are off. And a lot of people have said if they didn't have a quick answer for me, they always got back in the shortest amount of time. And that says a lot about our staff. And I thank you and the staff for a great job.
Thank you.
Well done. Thank you.
Thank you. I will pass that on to them. We really do have an amazing team, local team.
Any other questions? Thank you very much.
Thank you. Appreciate it.
Next item, review services provided by health. Oh, I think Kathy's here. She pushes my button. Review of services provided by Health and Human Services.
Thank you, Mr. Chair. And just to add to what Supervisor Osnes said, I think we're very fortunate to have a leader in Rhonda who's regarded not just by the consortium and the state, but by her own team as a very knowledgeable, compassionate, and effective leader. So I think I have to stop and remind myself after those directors' calls that we're very fortunate to have her here. And she does a fantastic job. So thank you for that presentation. I thought a lot of complicated material is condensed and simplified as much as possible, which I'm going to, thank you. So I'm going to move on to the service review for the Economic Support Division, which I'll admit Rhonda helped me with. So I'll try and give a general overview of what we looked at here and how we structured this. That first item, Wisconsin shares child care subsidy in the left-hand column. I clarified with Rhonda before the meeting that this is a mandated service, but it's not mandated that a county provide it. The reason that's in our scope of service delivery is because it fits nicely with the other things that Rhonda mentioned that the Economic Support Division does. So that particular service, and she has more historical knowledge about how that came to be a part of the work that she and her team does. But that says no on there in terms of mandated That's because we're not mandated to provide it, but it makes sense for us to. And she can explain that further if you want further clarification around how that came to be. The other thing on that same column, or I'm sorry, that same row, excuse me, under funding, is that I had put on there that it's primarily a federal and state funding with some tax levy. But in talking again with Rhonda over the past about 12 years, there hasn't been tax levy used to fund that particular service. That the state and the consortium make us whole at the end of the year. That's probably an oversimplified version of why we don't use tax levy, but I wanted to clarify it because I had mentioned on there that tax levy was used to support that service area, and it generally, as of now, is not. The other thing I would mention as we go down the left-hand side of the form there, the spreadsheet, again, with Rhonda's help, we broke it down into the different service areas or areas that are specialty services correlated with the statute that mandates that particular service. The mandates in terms of the service level, that is, whether we have discretion or not and how much of that service or how little of that service we provide, it's really dictated by contracts with the state. So there isn't much room to navigate that. It's all based on contractual outcomes that we, or services that we're required to provide. So there isn't much wiggle room there. And then I'll ask for questions, and while Rhonda's here, she can help me answer them. But the very last thing on that left-hand column is what Rhonda mentioned, the Wisconsin Home Energy Assistance Program, or WEAP, it's sometimes referred to. And that was something that we had an administrative function in providing, overseeing the work that WESCAP was doing as the provider. We decided not to serve in that administrative role, partially because the state very much wanted to contract directly with the provider, with WESCAP, for cost savings. Our argument or our discussion around why we might want to stay in that administrative role had to do with our knowledge of the consumers, the residents of our county, and having some particular, I think, advantage in terms of assisting them or administering this program with that knowledge that we thought would be beneficial to the residents of the county. But when we looked at the costs involved, which would have required additional tax levy to administer this program that way, we decided in the end to allow the state just to contract directly with WESCAP. And we're not overly concerned about how that will go. But again, I think it speaks to Rhonda's interest in looking out for what's best for the residents of our county, the consumers of these service areas, and wanting to make sure that we do the best we can by them. So we put that on there just as an example of a discretionary service that we decided in this case not to continue administering. So it was sort of an example row on there, but understand that we don't do that anymore. Did you have anything you wanted to add, or did I explain it sort of okay? All right. Thank you. Okay. Rhonda's world is very complex and regulated, so there's a good chance if I go into too much detail, I'll just say something wrong. But I think in looking at this with her, I think it's accurate, and I think I'll just see if you have any questions, and again, she's here to help me answer them if you do.
I was just going to add that for energy assistance, the work is done in an entirely different system. In addition to that, the Department of Administration and the division just have cut funding every year. So when we did the program, it funded in one FTE, and that is not the case. So, there were several reasons why we subcontracted it, and then an additional kind of decision, obviously, at this point, which was somewhat outside of our control, only because DOA wanted to continue to cut funding. So we just had to let it go. So I was just going to mention that. In addition, for income maintenance programs in statute, it actually refers to the fact that a public employee must confirm benefits, which means that someone else could potentially do some of the work. They can't confirm eligibility. So really it comes back to us and as mandatory and mandated for us in comparison to childcare, where it might be a bit different, although childcare is done in the same system that we administer income maintenance programs. And in addition, our call center that we mentioned, we actually have a childcare queue. So that just speaks to the efficiency for our customers. They can call one place and receive those services. We, at one time, had discussions many years ago with the Department of Administration in terms of embracing our consortium model. DCF did that. We had to prove to them that we could do this and that we would do it better than anyone. We did that. And so they've really embraced our call center and embraced our consortium model. DOA went the other direction. So again, just kind of giving you some perspective on why some of those things happen. So mandated versus not. Sorry for the interruption.
No. Any other questions? No? No? Great. Thanks for, I'm still confused, but, but a little bit clearer. Thank you.
Thank you.
Updates on stakeholder meetings related to healthy and affordable housing. I believe that's you, Bob, again.
Yes, thank you, Mr. Chair. Over the last almost 30 years I've been doing this kind of work, housing has always been an issue in whatever capacity I was working. And when I came to St. Croix County a little over 2 years ago, it was apparent to me that affordable housing and safe housing and the same issues applied here as they do in other places I've worked over the years. Chair Telejohn was very, I think, appropriately concerned about the housing situation in St. Croix County and interested in looking at solutions for how to better assist people who were either in temporary housing or homeless in the county. And continues to be a concern, and there's no easy answers to resolving it. I think the tendency is to say build more shelters, build more low-income housing, but the kinds of real factors that play into that sort of thinking are considerations around transportation, considerations around childcare, other factors that influence a person's ability to maintain housing and afford housing. So there's a variety of different things within a person's ecology that determine whether or not they can maintain housing, including mental health, addiction, and other kinds of things that interfere with a person's ability to maintain employment. Or maybe they just make a little too much money to qualify for some of the benefits that Rhonda's team offers, but not enough money to afford the other things they need. With housing prices rising, of course, and inflation, that just exacerbates all of that. Anyway, about a year ago, Chair Telejohn can correct me on the timing, but roughly a year ago, there was interest amongst this board to look at pulling together a group of stakeholders, people who have expertise and who operate agencies related to housing and homelessness, and other aspects of community development and health and human services, and other key stakeholders that would have a position on how to improve the housing situation in the county. About that time, as we were discussing that in this boardroom, the United Way, St. Croix Valley United Way, applied for a grant that had a very similar objective, and that grant was to do, like I said, a similar thing by pulling together stakeholders with varied interests and expertise in this area and finding out what kinds of policies could be implemented, what kinds of strategies could be implemented to improve the housing situation for those that are either homeless or in temporary housing. What happened as a result of that was the United Way of St. Croix Valley got the grant, and I was invited, as were other stakeholders, to take part in these stakeholder meetings that are referred to as safe and healthy housing. We've had 3 of those meetings so far, where a lot of it's consisted of first understanding the problem locally. What are the issues in St. Croix County that might be unique or might be comparable to other counties in this state or in other states? And then do a broader policy scan to better understand how some of those, excuse me, some of those other counties or regions or municipalities or whatever they were, address the issue of building affordable housing or providing affordable housing. And sometimes it's referred to as workforce housing, or it's referred to as emergency housing. It kind of depends on the location. But this stakeholder group uses experts from all over the country, mostly I think in the West Coast, Oregon and California, to help, who have a national interest in doing this, to help us look at ideas and policy strategies that have been effective in other places. And again, the thing I want to tie this into is why are Health and Human Services involved in a housing issue? Well, because for many of the reasons that people are homeless are the same reasons that we provide care: addiction, mental health, financial reasons, etc. So the role that we can play in this policy discussion is to say, how do we impact those things that oftentimes lead to homelessness or housing challenges for people as a human service department? How do we look at those kinds of situations and say, here's an area where we could assist by helping people become eligible for benefits and connecting them with available resources, by providing on-site mental health and addiction services for people that suffer from those conditions, from any sort of the, applying any sort of the assistance that we already have at our disposal to those situations to help people get housed. And to work with our community partners like Grace Place and West Cap to better understand the approach we could take in doing that. But I'm getting a little ahead of myself here because we're still examining those kinds of policies as a part of the policy scan that we're looking at as this stakeholder meeting continues. And at the end of this, in a few months, we should have specific recommendations that we can make to this board and to other departments within the county, if that's appropriate, and see if we can present something tangible to all of you that might be an effective way to move forward to assist with this housing issue. Again, being a primarily rural county, transportation is a big problem, as are just the other factors that I mentioned, social determinants of health. You hear that term a lot, but those kinds of things are factors to consider so that people, once they're housed, we can keep them housed and support them in that. One of the things that we're doing as a department directly to support this has to do, again, with the populations that we serve. But with people who have addiction or substance use disorders, oftentimes it's very difficult for them to get housing because of their condition, but also because they may have criminal records that prevent them from passing background checks that landlords do. And it's difficult for them to find employment a lot of times. But what we can do is support recovery housing in our county, and most of who we work, or the primary provider we work with there is Onyx House. And we've been able to use ARPA funding to supplement or to cover first month's rent for people that are financially eligible for it at Onyx House, which allows them a little time to adjust to early recovery while they look for employment and while they look for longer-term housing. So it provides a little breathing room for those folks, takes a little stress off of them, and it supports the recovery housing effort, which is something I hope will expand as DHS looks at evolving their Medicaid and other support for us. I don't want to talk too long, but I just want to make sure I kind of covered where we're at with things, and if you have any questions, I'm happy to try and answer them.
Bob,
Yes.
how many people can Onyx House handle?
They're expanding all of the time, Mr. Chair, so I couldn't say a number of beds. I know they're opening new houses, and some of them in St. Croix County, some of them in other counties. And actually, they haven't been at capacity here in St. Croix County. So part of our interest is in looking at why that is, because we know there's a need, and trying to figure out through some of our community-based case managers and co-responders with law enforcement to see if we can better connect those folks with this resource so that we're utilizing it more effectively. I don't know the number of beds offhand. I can certainly find out, though. And the occupancy rate.
Yeah, I know like Grace Place, their capacity and
Yeah.
with a waiting list.
Yeah,
So
And-
that's the only other shelter I know of,
yeah.
right?
Yeah, and I've worked in homeless shelters before. And you really, once you work in an emergency housing situation, you realize that people come from every walk of life, every educational level. There's a variety of circumstances that'll sometimes people find themselves in where they need emergency housing, and so it's not. I think what often is thought of as it's folks that are commonly in these situations, but it's not. It's a mix of folks that working month to month or living month to month just find themselves all of a sudden unable to pay rent, and there they are. But they are at capacity, and we do provide on-site care or services there through our community-based case managers through Arpa Funding right now. So they can go to that facility and work with people on site and try and avoid situations where people, they might get removed from the facility for behavior or other reasons, because they can't manage the level of severity that someone is there with. But hopefully we can help manage those situations better and help people stay in housing, at least emergency housing, until a better option comes along.
I know I saw just this week a Facebook post of a veteran trying to find where you can go to get help for.
Yeah.
He was living in his car, and he didn't know where to turn or anything, and there was some very positive comments of where to go, but, I mean, the veterans need right.
I know that kills Phil Landgraf and myself when we see stuff like that. And that's, again, our interest is in finding those folks and helping them get what they need. I don't want anybody out there in the cold if there's a way we can assist them. Some people will refuse to go to a shelter. There are various reasons for that, but we want to make sure that we're trying our best to reach and engage with everyone who needs a shelter, especially in the wintertime. And I'll keep the board updated as this stakeholder meeting progresses. I know it's frustratingly slow getting to a solution, but we want to get to a good solution, or at least a good set of recommendations that we can present. So,
Does anybody else have any questions regarding that? Thank you very much. That's the end of the business items. Is there a request for any future agenda items? Well, okay, we'll make it up then as we go. Announcements or correspondence? Any announcements or correspondence? Go ahead.
Thank you, Mr. Chair. I wanted to just welcome Dr. Anwar as this first board meeting, and thank you for serving in that role, and we look forward to working with you.
Thank you for having me.
In addition, I just had a couple of things I was going to mention. We did receive ARPA funding for work with community partners, community partner organizations, and we haven't spent too much of that yet. But what we intend to do with some of that money, and we have about $70,000 in that program code of ARPA funding. What we intend to spend that on is a couple of things right now anyway. One is to provide groups for parents with young children at the services center that are facilitated by Family Resource Center. The intention behind this and these particular groups is to, from from last summer through the end of this year would be to provide a curriculum on protective factors, things that serve people well in providing, in parenting, and in providing for their families, and finding resources, things that they already have that are beneficial to their success, and helping them build upon those things. It's open to anyone in the county with young children, kindergarten age or younger, any parents. And we've had about, I think, an average of about 8 to 9 parents and their kids come every month to these. They're held again at the services center. And the kids have childcare provided. We serve a lunch for the families as sort of an incentive to come and to give them at least a good lunch that day. We're going to continue to work with Family Resource Center beyond the first of the year with what's called a Parent Recovery Cafe. Again, it's a curriculum, evidence-based curriculum, that tries to assist parents with either substance use issues or in working or helping someone they know with substance use issues to get into recovery. Again, this is open to parents with young children, same location, same time of day, everything pretty much the same. But the training required for that is a cost that we can help cover for Family Resource Center. And again, it strengthens that relationship we have with them, and hopefully will build kind of a different relationship with the community by saying, this is completely voluntary. It's for your benefit if you would like to come. We're not going to take notes. We're not going to try and enroll you in something. It's simply for the benefit of the parents to learn more about these kinds of things. And with addiction or substance use being a primary driver of child out-of-home placements, we want to do everything that we can to preemptively work with families to help them stay healthy, and again, with a focus on wellness rather than a focus on deep-end illness all the time. So these are new initiatives. They're so far anyway have been well received by the people that have come, and we're going to continue those through the end of '24 as long as our funding supports that. The other thing was we're supporting a foster parent recruiting event through the St. Croix Valley United Way. That's being planned right now, but they'll have a guest speaker, I think a former NFL player that was in foster care, who's a national speaker, come in. The effort there is to recruit foster parents, again, to help supplement the foster parent resources that we have in this county for all of those kids that might need that kind of help, and build up that network. So we're going to use some of that community partner Arpa funding towards that event, and I'll have to let you know when that event is planned and the date and all of that. But I think those are my announcements. Did I forget anything? No.
I don't think so.
Okay.
I was just going to mention, just because, again, it is a confusing, to piggyback on Rhonda's presentation, so the lobby services, people can come to our lobby to get services, to apply for the services. They can pick up a paper copy, they can use the phones, but to piggyback on her consortium presentation, I highly recommend, if you have constituents or people that you know that might benefit from any of these services, to call the consortium. It's their quickest bet. They get a case made immediately, and then their services at the services center are then a little more easy to be managed, so they can bring documents for us to connect to their service, things that they need to submit. People often ask, can I just get a paper copy? And yes, they can, and we will give them one. It's very complicated and daunting, and so if they pick up the phone and make that call, it connects them immediately, and they get the answers they need. And so again, I know it's hard to, though that her staff aren't at our building, they're picking up the phone for someone that's calling and making that connection for them. So it's a change, and I bring it up because just this week we had a gentleman, an older gentleman, come in, and he said, well, I used to come here, and there were people sitting here, and they would meet with me and help me, and it's like, yes, that is the way it used to be, but now this is how it works, and I'm telling you, please, and they can use our phone in our lobby if they need to, if they don't have a phone or they don't, but please just make that call with them, but if you want a paper copy, you certainly can have it. So anyway, I just want to piggyback on their efficiency of helping people if they call the consortium. And so, again, if you know people or have constituents that would benefit, I would just highly recommend that they make that call, so.
Oh, that's right, sorry.
Land speed record.
Yeah.